Scotland has a long history of success and utter failure, but so has every other country in the world if you look at what they've tried to do. And 12 years ago when I came back from the States, having had a deep learning in this, but never having actually tried to improve anything, I was privileged to lead the Scottish Patient Safety Programme, which was an attempt to improve the safety of our hospital-based care. And Scotland now is a global leader in that, not because of my work, but because of the work of thousands, using proper change theories of implementation. Taking evidence that we knew, the recipe, that was well known, you could find it very straightforwardly. What wasn't done was implementation at scale. And that's what we did. And it seems so simple now when you think back. It didn't feel simple at the time. It was hand washing. It was bundles of care about how we use antibiotics. It was checking that you had the right patient in the operating theatre. I mean, surely we did that. Well, no, we didn't always do that. So now those implementation elements are done reliably every time in Scotland, using the principles of implementation and improvement science. I think Scotland has some things to learn from other countries, but it also has things to teach. I think we've got really good examples of successful execution and implementation. Some of them are in health, some of them are in children's services, some of them are in early years work. We've even got some examples inside the government now, where we're sitting just now, of improving internal processes, like how we deal with freedom of information requests, or how we deal with human resources. And quite a lot of external facing things. We've done some work recently with the national parks of Scotland, using improvement science for a different set of priorities. Their priorities are tourism, cleanliness in the park, biodiversity. Now, who'd have thought that the dentist and surgeon would be thinking about how do you do biodiversity? But the principles are exactly the same. Work out what your purpose and aim is, measure your way to that, and implement the recipe of things that you might use to do it. It's not. It seems so simple when you say it out loud, and yet it's really difficult within human systems to do. So I think Scotland has a lot to teach, but also has a huge amount to learn. And in my sector, in healthcare, we've learned a massive amount from Scandinavia, who have led a lot of work in older people's care in particular. We've learned from pieces of the American health and social care system, who have taught us about how to make care safer. And we've learned even from further afield, from some low and middle income countries who have had to develop change and implementation strategies with no resource. And we've stolen shamelessly from them to make our work more successful. The safety work has, so I could list a series of percentages where the Scottish Patient Safety Programme has radically altered the nature of safety and healthcare in the country, and that's what I would normally do. So I could tell you that mortality has fallen by 20%, sepsis mortality has fallen by 20%, infections are down 90%. I think the intangible change is that the culture has changed. So every morning now in every hospital in Scotland there is a safety huddle at 8 o'clock. And at those safety huddles, all the senior leaders from the wards, from the domestic department, from the labs meet, and they decide there if the hospital is safe that morning. And they share challenges, experiences, and how they're going to make the hospital work that day. That's now being expanded into community care, into mental health, into some primary care environments. So that's unthinkable 10 years ago, completely unthinkable that we would expose that amongst our peer group. So I think the safety culture in Scotland has been transformed. And it's been transformed by implementation of task. So some people thought that the bundles of care, the focus on hand washing, that it was very reductionist. It is reductionist. But unless you give people something to do, something to change, they don't know what to do. And the implementation of those bundles of care, the drive to improve safety, has led to culture change. And I don't say that lightly. And if we'd set a culture change aim at the beginning, I think we would have failed because we wouldn't have had the tasks. So we needed the tasks in order to drive the culture. But I think the single most important change that we can now evidence is the culture change within Scotland's health and social care system.